Welcome to Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein. Today's show is on dental implants and smile-improving gum procedures. What are they? What can be done with them? Who are they for, and how can they improve your life? So if you're missing a tooth, have a bridge, wear dentures, or would just like a more confident smile, then stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. In studio today we have Dr. Orst Komarnitsky, who is considered by most to be one of Arizona's top implant doctors. Dr. Komarnitsky is a graduate of the Indiana University School of Dentistry and did his periodontal residency at USC. He is a member of the American Dental Association, the Academy of Periodontology, the Arizona State Dental Association, and is co-founder of the Greater Phoenix Dental Implant Prosthetics Study Group. Dr. Komarnitsky is an internationally published author and lecturer on the subject. Dr. Komarnitsky, welcome to the show.
Thank you, Michael.
I invited you on the show today to talk about dental implants and basically gum procedures, what you can do with gums. But before we get into that, tell me a little bit about your background, your practice, and why you chose Arizona.
Well, Mike, actually, I've lived in Arizona since 1960, and I've gone away to school in a number of different places. I had a great opportunity to visit a number of great cities and states, and I've always wanted to come back. Arizona and Phoenix in particular, in this area, is a great place to live and a great place to raise a family.
How long have you had your practice here?
I've been a periodontist for almost 20 years now, getting right up on, actually, literally 20 years.
Now, a periodontist specializes in?
Gum disease and dental implants.
So that's basically your entire, you don't do all the other stuff that a general dentist does. You focus just on the implants and gum disease.
That's correct.
All right, now tell me a little about your practice.
Okay. Mike, basically our practice is the majority of it is about dental implants. And we also do aesthetic recontouring of the gum tissues if you have a gummy smile. We have a great group of people in our office. We have our patients enjoy coming in. We have great people.
How important do you think
us.
that is?
I think it's really important because I think patients, a lot of times, people that come in my office have a lot of fears, a lot of anxiety about some of the procedures that we do. And one of the things that we're really proud of is the caring and the friendly and the good atmosphere that we're able to provide for our patients to make them feel comfortable on a daily basis when they come into our office. And it starts very beginning with the phone call.
So let's talk a little bit about the gum procedures first.
Sure.
What can you do? Can you, when it comes to gums, can you, if I have, maybe the gums are too low on my teeth, maybe, can you actually reshape and recontour those?
Sure. We help a lot of people with their smile. Maybe they have what we call sometimes a gummy smile, and we can make the teeth, remove a little bit of the gum tissue and make the teeth more pronounced so that they're more dominant, so you have a nicer smile, a more aesthetic smile. Also changing the shapes of the teeth also.
Well, when you see sometimes people have short teeth and they maybe get braces to try to pull them out. I mean, can you basically accomplish the same thing? And is it painful to have your gums trimmed back?
Yeah. In some situations, we need to do a combination of procedures, do the orthodontics with the aesthetic recontouring and the gum tissue rechanging. In other situations, we can just do it with just the gum procedure that we actually do. So you have to really kind of tailor each of the treatments specifically to that patient's particular need, to their smile, and what their face, how their face looks.
What about where the gum? I see where the gum, I want to say peels up, but recedes down from the tooth. Can you bring those gums back up?
You can do that. In a lot of situations, you can go ahead and you can bring that gum tissue back to its level where it was before the recession had occurred in that area.
Does gum disease normally cause the gum to recede?
In a lot of patients, yes, it does.
How many people do you think right now are walking around that have gum disease that don't know about it?
Yeah. Well, statistically, about 30% of people have some sort of gingivitis, early stages of gum disease, and as many as 70% of the adult population has some form of gum disease.
And you think they don't get checked or they don't get looked at for any particular reason?
Well, a lot of times people are afraid, or they get real busy in their lives and they don't realize how long it's been since they actually been to a dentist, let alone a periodontist. A lot of times people say, well, I was this about a year, and then they start adding up the time. They find out it's actually been 3 years rather than a year.
Wow.
And so they really kind of get caught up. And so we have very busy lives today, and a lot of times people just kind of lose track of the time, don't come in.
How long does it take to get checked? If I made an appointment and I came in, how long would I be there to to be checked for to see if I had gum disease?
Well, our initial appointment in our office actually lasts about 40 minutes or so. And during that time, we do a thorough evaluation of your mouth, check for any gum disease, check for any missing teeth, and also try to determine what your dental needs are and wants. And we'll also we'll take some films, some radiographs of your mouth to determine whether there's any disease underneath the gum tissue that we can't see.
What can untreated or unchecked gum disease cause? Can it cause you to lose a tooth? Does it cause bad breath? What are some of the downfalls of not getting checked?
Well, there's a lot of downfalls, and it starts off with one, periodontal disease, losing the bone that supports the teeth, the bone ligament,
so
altering your smile.
Gum disease can make your jawbone recede. It can cause you to lose bone.
Yes, it can. Very, very, very much so. And that's probably the major problem. Sometimes also you can see, sometimes you've seen maybe people that have where the teeth have shifted forward, and a lot of times that's because they've lost some bone in their front teeth, and their front teeth aren't in a stable position because of the bone loss, and they'll start to drift and move forward and get those big spaces in front
And that's
of the teeth.
because more than likely they didn't, I mean, if you catch it early, obviously can you
get it under control, sure.
What causes gum disease? Is it anything in particular? Is it drinking too many sodas? Is it bad oral hygiene? Is it smoking? Is there one thing more than another that leads to it?
Well, Mike, probably the biggest cause of periodontal disease is people not flossing and brushing their teeth properly. Gum disease is a chronic infection of the gums and the bone. And if you brush and floss properly, the vast majority of people will be able to control any kind of infection that they may have in their mouth causing the gum disease.
Is there anything, if I have, because you told me before that very few people, that the signs of gum disease, you don't normally see them until it's down the road quite a bit.
Correct.
Is there anything, bad breath, bleeding of the gums? I mean, if I brush my teeth and they bleed a little bit, is that just because I brushed them too hard, or is that a sign that there may be something wrong?
Probably the first sign that you could see at home on a regular basis would be blood when you're brushing your teeth, or blood in the sink. That's probably the first cause, the first thing that you would notice.
Don't your teeth bleed, though, if you brush them too hard?
No,
I mean,
they
I've
should
always
not.
heard that.
No, they should not, Mike. And so,
It means your bristles are too hard, or?
No. I mean, you'd have to really, really crank on your gums to make them do that, and you probably couldn't do that. Really, if you have bleeding gums, that's the first sign. For most people, that's the first sign of having that infection. Gum disease is a lot like termites. Very rarely are there any symptoms, and if you wait until the symptoms become obvious, it's almost too late to really effectively treat them. I mean, you wouldn't wait until if you wait until the doors came off at your house, you know it's too late to treat that area. So gum disease is very similar to termites.
And bad breath?
Bad breath can be a sign. Bleeding gums, bad taste in your mouth. You know, you may be draining some pus in your mouth.
And so if you've had bleeding gums, bad breath, soreness, tenderness,
a little bit tenderness.
Maybe your teeth hurt.
A little bit, yeah. It might be painful to eat or chew, or teeth are shifting, moving, a change in your smile. All those are indicators of gum disease, can be indicators of gum disease.
So you need to go get checked. Best thing, though, would be just to get checked. What should you get checked? Once every year or two?
Well, you should be having your teeth cleaned on a regular basis. And for most adults, that's really about once every 3 months. And you should be checked for periodontal disease or periodontal breakdown at a regular basis when you're having your teeth cleaned at the dentist.
And you think most people don't commit because of embarrassment, just because of what?
Fear.
Fear?
Fear is probably the biggest thing. And also embarrassment is a factor.
And do you think that fear usually is unfounded?
I think today, with all the great techniques that we have in dentistry to make patients feel comfortable, that fear is really should be a minimal factor in patients' decision.
And I know that you have, and we're going to have to take a break, we're out of time, but I know that you have a special machine that actually goes down and lets them see down in between the gum and the tooth to help alleviate pain, to help make it so it's not so hard for them to get down in there and clean?
Correct, yes we do.
All right, we've got to take a quick break. When we come back, I want to talk to you about implants, securing dentures, what's involved and what you can do with them.
We'll look forward to that.
You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.